So hello everyone and welcome to this case discussion series, case 17. So here we have a 30-year-old female who presented with irregular menstrual cycles and intermittent lower abdominal pain, and this is the MRI done for this patient. This is the sagittal image, T2 weighted images. The bladder is empty and there is a pedunculated mass arising from the anterior endometrium. Few cystic changes are seen on T2 weighted images. Endometrial fluid is seen around it. This is the coronal images. The mass is iso-intense to the myometrium. These are the T1 weighted images. Again, the mass is seen iso-intense to the myometrium. These are the T1 post-contrast images where there is subtle post-contrast enhancement seen in the mass. And it is seen arising from the anterior myometrium. These are the axial T1 post-contrast images. So this is a report that I had given that there was a large pedunculated intracavitary mass arising from the anterior uterine wall, which appears homogeneously iso-intense to the myometrium on T1 as well as T2 weighted images, and filling the entire uterine cavity and reaching up to the internal os. There was mild dilatation of the endocervical canal as well. The lesion demonstrates few internal cystic changes and subtle post-contrast enhancement. Features were suggestive of a prolapsed endometrial polyp, but the possibility of a pedunculated submucosal fibroid could not be completely ruled out because of the signal characteristics on T1 and T2 weighted images. Hence, ultrasound correlation was required. There was no obvious pelvic lymphadenopathy that was seen. On ultrasound, what I could see was there was a pedicle artery sign, which is actually a single feeding artery, which may be seen extending to the polyp on color Doppler imaging. And I could see that particular artery. I don't have the pictures here, but I could see the artery supplying the polyp. And also there was interrupted mucosa sign which was seen on the anterior endometrium. There is another sign called the bright edge sign when the polyp completely occupies the endometrial cavity, and it occurs on both sides of the interface at the transition zone between the myometrium and the endometrium due to the difference in the acoustic properties between the polyp and the endometrium.